Hi, folks. This is John Dubas with Premier Marketing. I want to thank you for coming on the line with us today and learning a little bit more about growing your DSNP sales through United Healthcare. We'll be spending a bit of time on making certain that you have some particulars, not so specifically on plan details. We went over that last month with Mr. Steve Plochek. He's back this month to help us find where those prospects are. We wanted to remind you that we are an organization that offers these contracts across the country, part of the Integrity Marketing Platform, offering contracts at the highest available commission levels, including recruiting contracts. We are celebrating our 50th anniversary, so we've been around for a long time, and we are the largest producer with a number of carriers, including our featured partner today with United Healthcare. We do have a full portfolio of products for you across the board, including a number of very strong carriers in the Medicare Advantage world, in the prescription drug world, the Part D standalone programs, and across the board with different Medicare supplements as well. As I mentioned, we are going to be spending today, the next hour or so, 45 minutes to an hour, discussing different marketing strategies to place you in front of folks to offer the strong portfolio of products that United Healthcare offers, specifically their community plan, that is their dual special needs program. It is a program that is a part of their overall portfolio, and what we're going to do today is feature Mr. Steve Plochek, who is the Regional Sales Director for the Central Region. He'll be speaking to us regarding part of their SEEK program, and it is the portion that we are focusing on today deals with search, and this is the first slide of Steve's program. So as we go in there, we're going to visit as to where are DSNP programs. And at this point in time, I'm going to turn the presentation over to Mr. Steve Plochek. Steve?
Thank you so much, John, and I really do appreciate everybody being on the phone today. As John said, this is one, basically, if you would call maybe a chapter of what we call SEEK on the United Healthcare dual SNP side. You have search, engage, enroll, and keep. Well, the big area that everybody really wants to know about is really that whole search aspect. So specifically, let's just kind of start off. Where are you going to find duals? You really got to go where they are. They're normally not coming to your retail office, or if you're doing a community meeting somewhere, normally, you can get those folks, but a lot of times you got to go to where they're at. So specifically, what we'll focus on today in this presentation is where they eat, where they sleep, where they pray, and where they socialize and access services. So they're doctors. So we'll kind of go over some of these food banks, low-income housing, faith-based organizations, and providers. Next slide, John. So we're going to go through each one of these as far as where we got about what is it actually, who, why, how, where, and when. Next one, John. Next slide.
Community outreach.
Yeah. So specifically, let's go ahead and start with, where these people, where they eat. And a lot of them are eating basically at a food bank, anyone basically in a low-income individual or family, who goes to a food bank? Unemployed, physically disabled, mentally ill, or homeless. And a lot of those individuals, that's where we find a lot of our dual eligible, our Medicare, Medicaid eligible individuals in our markets. Go ahead and hit the next one. So to make sure everybody understands what a food bank is, I've talked to a couple different agents, and oh yeah, man, I got this food bank. It's this disabled or this discount bakery. Well, that might be a great opportunity, but it's not a food bank. A food bank specifically, all food is supplied at no charge. You see the last bullet there. But a food bank basically, a variety of sources, different kind of stores, sometimes a warehouse, maybe even a charitable agency. Who turn basically a provider into their clients in need, basically. So, you're looking for basically those low-income individuals. These are great partnerships. When I've gone into brand new markets, Michigan was a brand new market. for 2018. They're like, well, what's the number one thing that agents do to help drive sales? And it was food banks. Next slide. So we might have gone a little quick there, John. Go back one slide for me. I'm sorry. No. All right. Now you're good. Go one more. I'm sorry. Okay. So what you can do is you can go to foodpantry.org. And if you went on foodpantry.org, let's say you were in the Oklahoma City market. But bottom line is, I would write that foodpantry.org down right now, and you could go look in your market and specifically go to that website. It's going to show you basically where some of your larger food pantries are in your market, so you can be a little targeted in that scenario. Go ahead, next slide. So we went in there, we put in our state. Go ahead, next one. So in that scenario, great website, kill a little windshield time for you guys. And then basically, you can go out there. Again, it needs to be a face-to-face scenario. But again, you got a website. Why? It's where they eat. Next slide, John. So educate that front person. I really want to try to really look at that gatekeeper or that manager of that facility as somebody who I'm selling. I would want to take like a benefit highlight, maybe a brochure showing, hey, specifically for people that are on Medicare and Medicaid that live in this area that don't have end-stage renal disease, and they have Medicaid, and these are some of the specific benefits they get. So you want to go over that whole deal. Do not pick up the phone and call. If you want directions, you can do that, but don't think that you're going to basically get in the door with a phone call. We're face-to-face sales guys. You want to sell yourself in that situation that, this is part of your community. You live in this area, you work in this area, and, you want to partner with this individual, this gatekeeper, this manager, to help people in the community in this situation. Bring basically, that OTC benefit catalog. Bring a brochure, show something about dental in that situation. So once you basically get in with that individual, what you're trying to do is you're trying to set up basically, what I would say is let's slip in my mind now, an informal sales event. And then what you want to do is you want to be a little separate from them. If they're handing out food, you don't want to be in that same line, handing out maybe some toilet paper. Maybe some little tiny shampoos that you pick up from a Walmart, something like that. Maybe a little Palmolive or something. I've seen agents go to Sam's, buy a whole big, double pack of Q-tips, put basically, 12, 15 of them in a little baggie and hand those baggies out. Hand those Q-tips out to these individuals. A lot of times it might be more of a toiletry item or a cleaning item than actual, some type of food or something. But set up that informal sales event. Use basically United Healthcare's community and state toolkit to brand yourself up, pull up banners, put up as many as you can. Maybe you get a shadow box. There's shadow boxes that are available through your local Medicare and retirement agent managers that can actually, it samples of different items that you could get in an over-the-counter catalog. When you're talking to these folks, you definitely want to watch your jargon. We don't want to be using an OEP, IEP, SEP. Hey, are you a dually? Obviously, you're not going to speak to these individuals in that way, but make sure you thank them. When you're working with, this manager or this gatekeeper, that you're allowed to come in there and partner with them. You want to make sure to let them know that you really do appreciate, the time and the opportunity they've given you to work with them. And a lot of them, like I said, this is the number one, driving grassroots opportunity that we see across, specifically, I will say for sure, the central market. Go ahead. Next slide, John. So low-income housing. I think we kind of understand what that one is. Go ahead and hit the next one. So bottom line is low-income housing takes many different kind of forms. I think we kind of understand Section 8 housing. You know, there's all kind of different opportunities out there that we see through either HUD, you know, nonprofit organizations helping them with low income needs or housing needs. You also can look at affordable housing options located in those lower income areas in our neighborhood or in our markets. Next slide, John. So we talk about that demographic that, you know, normally these folks, once again, just like the food pantry, they're eligible for a dual SNP all over their area. We can get online, and I'm going to show you a website here in a second that I've used and I know agents have used to do a little bit of research for you, just getting out in front of the windshield. There really isn't a set time or month, but I will tell you that one of the things that, you know, a lot of these organizations that have oversight or, you know, set up maybe an apartment complex, one of their responsibilities is to have events, is to have activities for these folks. So they have a director there that is looking to fill up their calendar and looking to have different kind of events and opportunities for, you know, their residents that live there. You know, again, this isn't really a phone call-y kind of situation. You want to basically be there, you know, in a face-to-face manner. And obviously why? It's where they sleep. It's where they spend a good bit of their time. And there's a couple of the websites right there at the bottom. And I think I'm going to show you another one here in just a second. So write those down, affordablehousingonline.com or either Low Income Housing US. You're okay, John. Go ahead, the next one. So basically, if you go to that Low Income Housing US, go in there, click on your state. You can go in and start looking specifically at markets, you know, specifically, you know, whatever market you're working. Next slide, John. Here's an example. If you happen to be in Oklahoma, here's one in Oklahoma City. So you have an address, you have an area, you can do a little bit of research on your zip code. You kind of understand where that's at. Next one, John. You might have gone a little quick. Go back one more. Sorry. Nope, you're good. You're good. Mobile home parks. There you go. So mobile home parks. I have an agent basically down in Florida. I've been in this business for about 62, excuse me. He's about 62 years old now. He's been in the business since his late 50s. Been doing it for probably about 6 or 7 years. And one of the big things that he doesn't do food pantries, but he does low income housing. 50% of what he does, and I'm going to show you another thing he does here shortly. But specifically what he does, and evidently in Florida, there must be a whole lot of mobile home parks because this guy does a lot of business there. And all in all, you know, he'll go in, he'll talk to the individual, try to find like a landlord and ask if they have some kind of community room. Sometimes they do, sometimes they don't. He's got himself a couple of tents, United Healthcare tents, sets those tents up kind of in the front area, brings in some bottles of water, and he's done a ton of business basically in mobile home parks. But, you know, not always low income housing, but many times it is. But this is also a really good opportunity for a lot of agents out there, especially when it comes about where they sleep. Next slide, John. So, couple of tips. What could you sponsor? That's that monthly, you know, activity out there. You know, maybe it's an ice cream social, maybe it's an LIS clinic, maybe it's what's new with Medicare, maybe a birthday bash. You know, I got agents out there. This is a pretty intense one. Listen to this one closely. Guy goes out to a cosmetology school and finds a young lady basically just getting her license. Says, I'm going to pay you $10 for 15 haircuts. We pay her a total of $150 under basically, you know, $15 as far as CMS goes. And he goes to basically that low income housing activity director. All right. And says, hey, what if I basically gave the first 15 people a haircut that came down to the basement or to the community room? You can work with basically your local agent managers in your markets to drive this kind of business. But we've seen this be very, very successful in many different markets out there. Now, a couple ladies had started talking about like pedicures or manicures. I think you're gonna have a little bit of trouble finding somebody to do that for under the $15. And I would recommend you stay as close as you could, just to even be more conservative. That's just my rule of thumb. I always try to stick around $10 in that scenario. But that's definitely an idea. You know, I haven't heard anybody get turned down with that one, that, hey, we're going to give 15 people a haircut. So that's an opportunity you certainly can use. When you're talking to these folks, make sure you call them by names. Little tips that I'm putting in here. I think if you can find out who that individual is, call them by their name. Just don't kind of point at them, or, just talk in generality. Specifically use your name when you're talking to these folks. And I'm talking about like that executive director. Build basically, or that event director, build a relationship with that individual. Next slide, John. So faith-based organization, where they pray. Real quick, I want to let you know all the churches I'm showing you is in Hawaii. I thought that'd be cool. Next slide. So faith-based organization, I think we understand what a church is. I did not know when I first started as an agent, basically working with Salvation Army, I did not know that that was considered a church, a religion. This was many, many, many years ago, but at the same time, definitely Salvation Army is an area to work. But, it's a particular religious ideology that, has a religious basically orientation or mission statement. I think we understand where we're coming from there. Next slide. You got it on there. Thanks, John. So who? Include organizations who are connected with religious groups, and can include churches, clothes closets, social service, etc. Start with the churches, ask them about the organizations they partner with. I'm going to show you a website here at the bottom of this page, this churchangel.com. It's a great organization, or it's a great website to really find organizations specifically in a targeted area. I'm going to show you the second thing that basically this agent down in Florida, he did a whole lot of. But next slide. So this is what the fella did. Went out there and he basically hosted a pastoral appreciation event. So he basically goes and talks to some pie and coffee place, asked them if he could, have a meeting there, set it up as an informal sales meeting, and basically invite preachers, clergy from basically a specific zip code, from a specific neighborhood, and ask them to come on in. And then just hey, bring them in, say, hey, you want to tell them thank you. Maybe you buy a potted plant for every single person. You buy a couple extra, just something really simple. But tell them thank you. But what you're wanting to do there is ask them, hey, if you're sitting there in front of, let's just say, 6 different preachers, 6 different churches, what you're looking to do is basically get in and be able to talk to their Medicare and Medicaid eligibles. And I'll be honest with you, you'll also find a decent amount, depending on where your neighborhood is, you find a lot of age-ins as far as just traditional Medicare goes. So this is really a neat deal. For the longest time, this guy down in Florida, he wouldn't tell me basically what he was doing. But finally, it took about 3 years afterwards, and he said, I'm going to tell you my secret. He goes, I work with preachers. And it's kind of funny the way he said it. He told me, he said, preachers say no nicer than anybody else. And I thought that was kind of interesting. He said, Steve, these guys are sales guys just like us. They're selling some kind of salvation or something. But at the end of the day, they're selling just like we're selling, Steve. So I thought that was just kind of interesting the way he asked. But, ask him if you could set up, some kind of a booth or a table, maybe around, maybe it's not on Sunday. Maybe it's, maybe it's Wednesday nights. Maybe it's around a senior basically Sunday school or something like that. But all in all, you want to set up, you want to ask them, hey, could I come in and, meet with your folks and help them? Once again, you would want to be doing a full-blown presentation as you would to a gatekeeper at a low-income housing or a food pantry, explaining to them what it's all about. Talk to their level. Don't use a lot of crazy jargon. Speak to them by name. Get to know these individuals, build a relationship with them. Because think about that. If you were meeting with 6 preachers, break down, let's say, a third of basically their, they got, let's just easy math for me, you got 600 total members or people that are part of those congregations, half of them, could possibly be in that senior area or getting ready to age in that situation. So, maybe you got 300 of that 300. How many of them are getting ready to get on Medicare? How many of them are already on Medicare? How many are dual, pending what kind of zip code you're looking at in that scenario? So this has been something that I've also seen that we've kind of spread across 2000, really the end of 17 into 18. We've seen a lot of agents getting a lot of traction with this whole pastoral appreciation event. Next slide, John. So providers, I think doctors are a huge opportunity. Doctors, dentists, I'm really not going to go over home health care, but basically it's the same kind of scenario as you would work with your doctors. But all in all, one of the biggest referrals I remember, and even talking to John in his day of selling, was, when you heard basically from a prospect, my doctor said to call you, John Dubas. My doctor said to call you, Steve Flochek. And those are just great, basically, opportunities for us to really, be there, to be that subject matter specialist for individuals in our market. Next slide. So bottom line is, what I would recommend is you kind of put together a little bit of a packet. Get a folder, put some stuff together in there that could kind of be at the fingertips. Because think about it. You walk into a doctor's office, you hit that gatekeeper, you hit that front receptionist. She's got a stack of basically files. She got the phone ringing. The doctor's a little extra chatty today. The waiting room's full. And then you walked in. You were a big old distraction. You better bring some value to that individual. That's the whole thing. You walk in there with your hands open and say, hey, give me a lead. It ain't going to happen. It ain't going to happen at all. So you need to bring something to specifically add some value for yourself. Go ahead, next slide. So here's basically an example of a provider quick reference guide. Of course, we can find all this stuff on the internet. All right, but understand, these docs, just like a lot of agents, they work with a lot of different, carriers out there. So at the end of the day, something really quick at my fingertip when a patient calls me and asks a question about transportation or, where do I go get hearing aids? You would have basically something there that would show that. And we have a medical quick reference guide. We also have a dental, and I'll touch on that in a minute, but a provider quick reference guide. I'll show you a website of where you can find some of this information here. But, basic information of just how you work with us. Understand that even if, these people, this doctors group has been with us for a while, or maybe even that individual has been with the doctor for a while as an employee, at the end of the day, there's still a lot of churn in doctors' offices. You see a decent amount of turnover with their staff. So it's always good to have maybe something in a hard copy that's there to educate basically new people coming in. Next slide. So kind of a little quick list, state provider quick reference guide. All this stuff you can find at that website there at the bottom, UnitedHealthCareOnline.com. And again, that's internet. That's anybody ever access to it. It's not just employees. Balance billing information, prior authorization. Maybe you come in there and bring some trifolds and some basic benefits. You can get that right off the toolkit. Maybe, bring a catalog in, just one. Maybe some information about dentists. All in all, that basically is a great opportunity there to, educate those individuals. Because, we think of these doctors' offices, let alone the doctors, half the time you'll never get a chance to talk to a doctor. If you do, it's a pretty lucky scenario. But if you get to talk to that billing manager, that office manager, that's really where you want to get. That's where I've seen a lot of success personally and basically through our agents. That's going to help you basically, build that relationship that, I don't want these people to sell. I don't want doctors to steer. But basically, if there are any kind of questions, you as an independent broker, you as an individual possibly representing several different plans in your market, a great resource. Hey, I would love for you to sell United every single time. I know that's not going to happen. But at the end of the day, if I can help you build relationships with physicians, with any individuals in your market, you're going to have a chance. You're going to have that opportunity to sell United Healthcare. Next slide. So balance billing information, just example of those. Prior authorization, again, we can go to that website we were showing you before. Next slide. So partnerships, identify your primary care and your specialist to visit. Make sure they're part of the network. Don't go out there and try to grow a network in this situation. Put your packet together, put some flyers in there, Ask basically if you can speak to that that business office manager. Take about 5 minutes, go through the packet. Don't just basically sit there and take that, just throw the folder at them. All right. You're going to want to go through that scenario and let them know specifically, what's in it. Hey, here's a quick reference guide. Here's some quick little benefits that we have. Here's a copy of our OTC benefits. So, all in all, those are great opportunities for you to have something to talk about as value. If the boom isn't available, get their name and come back. Again, this isn't a phone call situation. You've got to do it in a face-to-face manner. And what you're looking for basically that opportunity to put some of your flyers up. Flyers that you can obtain basically from United Healthcare's website or Community States website, no charge at all. Personalize it, your name, your phone number. You got questions about Medicare, Medicaid, boom, call me. You have that opportunity. But go ahead, next slide. So maybe we ask them if we could get some of these decals. These are available on the toolkit, no charge to you. You could put this up in their window. I mean, it's just going to help promote a plan that you sell at the end of the day. Next slide. So some of the top tips that we work with, a lot of people say PCPs are easier. They're easier than specialists. What I'm going to tell you at the end of the day, I haven't heard too many times that a pre-CP saved my life. The reason that a doctor or that a prospect, wouldn't change was because why? Oh, well, my cardiologist, he saved my life 3 times. I always got a giggle out of it. Try not to laugh out loud when you talk to a lady and they'd say this OB basically delivered all 4 of their children, and you're like, whoa, what the heck is this guy still in business for? But all in all, my point is that I wouldn't be too scared of specialists. That still could be an opportunity. And people that work basically providers, they hit PCPs first. So I would do a little bit of both. I would work with some PCPs, but don't count out specialists. And hopefully your market all right, or pretty well, and some of the key specialists in town. I think it's worth stopping by and giving a folder and see if you can get some traction in there. You might be kind of unique in that scenario. Well, what's wrong with being unique? What's wrong with being a little different than somebody else that's maybe on this phone call or in your market that isn't on this phone call today? But basically, find those providers that are contracted. It's good if you can find them if they're contracted with all of our plans. It's a little bit easier. It's more product, hopefully, for you to sell. Find them in those low-income areas. One of the things when you walk into an office, you ought to be looking around. Do I see any other marketing? Now, MIPA came out with basically their regulations and said if one carrier is going to basically be represented in my office, if I'm contracted with any other carriers, they have to be basically represented equally. All right. So if you walked in and you saw a competitor of United Healthcare, well, as long as that doctor is basically accepting United Healthcare, they should be allowing you. There's no reason they could basically say, hey, we're not going to let you put your stuff up because you as an agent. If you were representing basically United Healthcare in that scenario, they should be putting you or allowing you to basically promote yourself in United Healthcare. If they don't put flyers out at all, I'm going to tell you, some of the first sales that I ever got working doctors was specifically from the staff, signing up a nurse's mother-in-law, signing up a doctor's mom. That was, that to me was one of the biggest endorsements I ever thought about. I love the referral, but I mean, if a doctor's going to say, hey, mom, call Steve, he can help you out. Hey, I'm Dr. Jutris's mom. And John knows who I'm talking about with Dr. Jutris. But all in all, it's a great scenario. Just to say, hey, can I at least put some of this information out, in the break room, and who's going to see that? Obviously, staff people that work there. Next slide, John. All right, so let's move over to basically dentists. Same kind of scenario. Put your guide together. You're looking for that quick reference guide, a couple dentists, brochures. You're going to want to partner with dentists. Dentists are a little different. They can be a little bit more challenging, but there's also, with the United Healthcare dual SNP plan, it's very interesting the way it works with basically dentists at the end of the day. Next slide, John. Copies of the quick reference guide. So what I'm showing you here, and we can get you a copy of this. I can help get this to John for all the different markets represented on the phone today, and any other ones, John. We'll talk about it afterwards. But if you look over there to the right-hand side, at the bottom, there's that little grid at the bottom, and what it is it's procedure codes. Okay. So what that's showing there is if we have a $2,000 benefit in a market, okay, anybody who walks in with a, United Healthcare Community and State card has a $2,000 benefit. Here's all the codes, and it's obviously a lot longer than that. They blew this up, and it's only about a page and a half of different procedure codes that basically the dentist can bill United Healthcare Community and State members, your client, up to $2,000. You add them all up, or whatever the benefit is in your market. I mean, some of our markets, I think in Texas, one of our lowest ones is probably 1250, 1500 zone. But bottom line is, this is a really cool opportunity for individuals. It really helps them. And let me make sure I explain a couple real key things around dentists for you. Number one, the network of dentists. I'm a United Healthcare employee. Let's say I'm sitting in Fort Worth, Texas, okay? And I walk into a dentist's office and I have a cavity. Cavity is covered under our plan, okay? That dentist, number one, could be the same dentist that your client on Medicare and Medicaid would see. We use a commercial network, a United Healthcare, a Fortune 5 United Healthcare commercial network, basically for our dual SNP plans. So I could walk into a dentist as an employee of United Healthcare for some 15 years. I could walk into a same dentist that a dual SNP eligible or a dual SNP member would also go to. So that's number one. Number two, we walk in there for the same cavity. That dentist is going to get reimbursed the same amount for the dual individual as they would for me, an individual on a commercial plan, not Medicaid. There's a ton of doctors, dentists out there, they won't take Medicaid. Why? Well, the reimbursement's really low and it takes a long time to get paid. All right? If you walk into an office, a dentist's office, and you say, hey man, I'm Steve. I'm an insurance agent and I work with Basic United Healthcare and we have a great plan here in your market and it's for people on Medicare and Medicaid on an HMO. Well, when you said Medicare, a lot of times they would have hit 9. By the time you hit Medicaid, they'd have hit 1. By the time you said HMO, they'd have hit another 1. That's 911. That's right. They'd have been calling the cops on you. So in this situation, bottom line is, that's not what you do. It's not what you do at all. And I'll show you here in a second what you do want to do. But all in all, understand that the reimbursement is the same as it is on our commercial. That's number one. And number two, the network. It's huge. It's a huge network. Why? Because it's following that commercial network that United Healthcare has. So you see some of the, or next slide there, John. So some of the different kind of materials that are certainly out there. There's definitely, materials out there, as far as dentists go, to specifically, market yourself, around the dental benefit. There's brochures, there's flyers, some label, basically hand sanitizer.
Okay.
Now, a little bit. Yeah, let's take it. Hey, my name is Steve. I represent United Healthcare. Have your packet. Real simple. Watch this. Watch this. Everybody watching. I know you can't see me. Watch. Do you accept United Healthcare? That's all I'm asking you. Shut up. Don't say anything else. Do you accept United Healthcare? And then you show them that dental QRG, that QRG on the back page that has all those different procedure codes. And you say, individuals that walk in, and on the front of it, it shows the dual SNP card, the front and back of it. Individuals that walk in with this card have basically, let's say, $2,000 or $1,500 worth of, benefit per year, no charge, no co-pays, no co-insurance. But everybody that walks in with one of these cards is worth $2,000 to you. Do you accept United Healthcare? Oh, you do. Have your conversation. You're going with them for a while. They're gonna want to know a fee schedule. They're gonna want to know, well, how much do I actually get paid for that cavity? They will never give me a fee schedule. I'll never give John Dubas a fee schedule. You will never get a fee schedule. But on that quick reference guide, the dentist can log in and they can see what their fee schedule is, because they're going to want to know, well, how much do I get paid for a crown? How much do I get paid for bite wing x-rays or whatever it is? So all in all, understand that. So you can go to myuhc.com. Kind of jot this down real quick. myuhc.com, or you can go to that www.uhc communityplan.com. Go to the right-hand side. It says Find a Dentist. You can click over there, and you can find all the dentists basically in the area. So you want to go to dentists that are part of our network. It's going to be pretty expansive, but at the same time, don't waste your time to go with somebody that isn't on the plan. And I also recommend you spend some time on the internet before you start driving around. Once again, put your packet together, ask to talk to that business office manager, take 5 minutes to go through it. If you don't take the time, guys, trust me, they're going to file it in file 13, the trash, all right? So you want to spend some time, show a little bit of why this is valuable. Hey, if there's another time I could come back, would you like me to come back at lunch? Hey, could I bring lunch by? Hey, could I bring would it be all right if I brought a fruit tray by? Yeah. Why don't you do that? We'd have a little more time then. They're going to think you're not going to bring the fruit tray by. You bring the fruit tray by. You follow up on what you just said you would do. And you walk back in there and you show them your information. Trust me, the cost that you're going to pay on a fruit tray is going to be well worth it. But if the business office manager is not available, get their name, come back when they are available. Finally, ask them basically if you can put some flyers, maybe a pull-up banner. Again, no charge. A 6-foot pull-up banner that says $1,500 worth of dental. Got Medicare, got Medicaid, get $1,500 worth of dental, $2,000, whatever it is in your market. Be a great opportunity to drive some business and some sales. Next slide, John. So some of our top tips basically that we have, start with dentists that are contracted. I mentioned that. Review some of the benefits. Discuss how this can help them grow their business. Hey, look, you guys looking at interested in growing your business, just ask them straight up. I don't know how many folks aren't interested in growing their business. So if they think it's Medicaid, kind of freaks them out. They don't know how long they're going to get paid from the patient, nor how they're going to get paid from the state. But if they know it's United Healthcare, and again, do you accept United Healthcare? That's all we need to be talking about. Visit the office regularly. Bring them a small goodie if you can. Take the time to get to know that staff, grow the relationship, understand their business. And this goes for all these providers. Smile and speak positively. So, it's a sense of excitement. If you're not comfortable and confident and excited about what you're doing, I'll be honest with you. I don't care what you're selling. I don't know if I'm going to buy from you. It's just kind of the way I am. If you aren't passionate and excited about what you're doing, hey, why do I need to buy it if you don't even believe in it? There's certain products out there that I would really have a lot of problems basically selling because I don't believe in those kind of products. But there's other products that I believe in so well, and I haven't had any education other than just, experience as a consumer with them. I feel pretty comfortable and confident about those. And I could sell those probably all day long. But speak with basically that excitement. I strongly recommend that. It makes a huge difference. Next slide, John. Okay.
We're at the end of it, Steve. That was the last slide. So what we're doing now is just demonstrating the market support.
Good deal. Hey, I just want to pass on to you guys. I really appreciate you being on the call. If you guys have any questions, kick them over to Mr. John Dubas, and we'll work together to get some answers for you out there. There's definitely opportunity out there to sell basically this dual SNP plan. And I can't thank you enough for spending your time this afternoon on the call with me. I appreciate it. John, anything for me?
Nope, Steve, you've done such a good job with presentation. There aren't any questions, and we do want to remind people that this call is being recorded and will be sent with other information as part of the follow-up. I want to thank you, Steve, for coming on the line. I know your schedule is really hectic this week. We really appreciate you spending the time with us today. And
Thank you.
folks, watch for the follow-up, including this presentation from Steve. Thank you, Steve.
Hey, thank you, John. I really do appreciate you giving me the opportunity to talk to your great agents. I'm going to go ahead and hop off the phone for now, big guy.
Thank you. And folks, some of the reasons why you want to take that program and the marketing information you got from Steve and work with us here at Premier Marketing is because we do offer some additional programs to help support you, and it includes discounted E&O to agents that work with us, a discounted means of keeping your licenses current, discounts for the continuing education credits that may be required of you in your state. We also offer electronic means to contract with these different carriers. We speak of United Healthcare's community plan. If you look in certain markets, there are multiple programs. And then what Steve mentioned is, yeah, we'd like the business to go to United Healthcare. He would. But there are markets where there are multiple programs where the choice may point to another carrier, and we want to make certain that that's available to you. For example, San Antonio market, or as I say, San Antonio market has 8 different dual SNP carriers. We represent 7 of them. Using the electronic means to contract enables you to contract with multiple carriers with much less chance of coming down with carpal tunnel syndrome. We do also offer additional educational opportunities, and many of the programs that Steve referenced through his presentation, we expand upon and speak to different means of maximizing the return on those particular programs. If you're working with a doctor, use that as a point of contact for working your community for grassroots programs. We have programs set up specifically on working with faith-based organizations, with providers, and other programs that could be of help to you in expanding your agency. We do offer electronic support when you do have a prospect and you're looking to enroll them for multiple purposes with access to different quote engines as well. That electronic support for online enrollment programs include the use of Medicare Center, which is the program that we contract with to offer electronic contracting at a distance, so to speak. So remote enrollment processes where you can collect the scope of appointment electronically, store it within that database for the 10-year requirement, and make certain that you have top carriers available for your prospects and your clients electronically. We do offer an innovative program as well to put you on the social media map. Coverage Made Easy is a program that we visit with and is one of our training programs that we offer. It's a way for you to be active in different means of social media without effort on your part, small premium that comes with it. We do offer a full list of lead programs as well, including that information on community-based marketing programs, which include retail, faith-based organizations working with providers. We do also provide custom calling list for programs that allow you to cold call and hook you up with carriers who have leads available for you as well. There are some other things that we do with internet leads, and we do have a direct mail program that is deeply discounted based on production. So that information is available to you here. What we're looking to do is work with you. We want your business and we want to earn it. What we would ask of you is to take some of the information that you heard today from Steve, augment it with some of the other training programs that we have to go into greater detail in some of the areas that he's revealed as good marketing areas for the dual special needs plans. They can be incorporated into other programs as well. Specifically, if you're working final expense or life insurance or the under 65 market, rotating programs through churches and staying in contact with them on a regular basis is a great way to set yourself up as the subject matter expert in that area. And that's some of the things we talk about in some of those other training programs that we mentioned. What we need for you to do is make certain that what we offer in these various areas are valuable to you and could be a key component in your personal marketing plan. If that is the case, we'd ask you to work with us, contract, certify, and study, commit to actively market, and then move forward with it. Because there's the old expression, when all is said and done, more is said than done. Well, we want to help you move forward and begin selling very quickly. This is contact information for our organization, 1-800-365-8208. PremierSMI.com is our website. This is contact information for our Dallas office. Myself and two of my associates, we'd be happy to help you in any means that we could with any part of our portfolio, but we are passionate about the dual special needs programs, and we'd like to be your partner in that regard. Here we are again, 1-800-365-8208 at PremierSMI.com. We look forward to speaking with you in the very near future. Watch for follow-up from today's presentation, including a link to the presentation and the PowerPoint that you have seen throughout this afternoon. I thank you for investing time with us, your most valuable asset. We look forward to visiting with you once again in the very near future, and we wish you good selling. Thanks so much. Talk to you soon.